Open sterile tracheostomy kit on bedside table. Secure the sterile field. Pour normal saline into multiple compartments of the sterile basin. Open 4x4 sterile gauze and new inner cannula and drop onto sterile field. Open package of new trach ties next to the sterile field. Do not place on the sterile field. Don sterile gloves. If indicated, hyperoxygenate client for 30 seconds using the non-dominant hand. Remove inner cannula with non-dominant hand. This hand is now no longer sterile. If the cannula is disposable, discard it in the trash. If the cannula is reusable, place in normal saline to soak. Remember to keep your dominant hand sterile. If the client has a disposable cannula, replace with new sterile cannula. Use your dominant hand. If the client has a reusable cannula, clean inside and outside of the inner cannula with the brush. Hold the top of the cannula with the non-dominant hand. Dry thoroughly inside and outside. Replace the reusable inner cannula, inserting at an angle and rotate into place. Ensure that the cannula is securely in place. If indicated, reapply oxygen method as ordered. Use moistened cotton swabs or gauze to clean secretions around the flange. Swab from the stoma outward. Do not go inside the stoma. Maintain aseptic technique. Pat the area around the flange and stoma dry with gauze. Place split gauze under the flange. Keep it smooth and dry. Replace trach ties. Hold the trach with one hand. Secure new ties bilaterally before releasing the old ties. Be sure the ties are not twisted. You must be able to fit 2 fingers under the ties. Observe for skin breakdown. Label the dressing per facility policy. Dispose of used equipment properly. Remove gloves. Perform hand hygiene. Reposition the client to comfortable and safe position with call light in reach. Reassess lungs, vital signs, and respiratory status. Document the procedure.